The mission of Helping Hands was to take not only what people needed physically, but also what they needed psychologically and socially, and to combine that into our home care so that they could lead a life that was balanced and full, taking into consideration everything that applied to their diseases.
What I believe the role of home health care is allowing individuals to stay in their homes, have a high quality of life, being able to live by their own time, their routines, eat when they want to, go down and pick up the mail if they'd like, go to bed when they want to, take a nap if they'd like, as opposed to being on a strict set routine in, say, a nursing home or an assisted daily living service.
Our role is to really look at each individual patient and to make assessments and decisions with the family members and the client about what it is they need in terms of the people components of the job and how all that plays into maintaining them at home.
I first heard about Helping Hands probably about 2 years ago. Actually in the laundromat here in the complex. There were some other girls helping some of the other residents with their laundry, and I asked them who they work for, who they represent. They said Helping Hands. I thought they were very nice, and I thought, well, that's a good name for an agency.
What's so unique about Helping Hands is all the experience that we have as managers. I've been a nurse for 34 years, and I've spent the last 30 years in home care. So you really start to understand the dynamics that go with it, the political activism that's responsible you have to do with that, and all the other things that come into play with home care. And I think really being passionate about it, I mean really caring about what happens to these human beings. We just try to make it fun for them and to realize that they're not alone. There's a world of people out here who care about you, and to kind of take them under our wing as our family so that we can help them to feel better about life and to really not feel lonely, because that's a simple cure. And if we focus on that, then we all do better.
While Helping Hands can help us with the physical side of caring for seniors, then we can do more on the emotional side. Like I can take her to Walmart, I can take her out to lunch, take her to her medical appointments, rather than having to do so many of the day-to-day things.
Happy birthday to you. Happy birthday to you. Happy birthday to you. Edward. Happy birthday to you.
We're very lucky in that we have at least 2 100-year-old individuals within our organization. We will send people out. If it's a lady, we typically give them 100+ roses. If it's a man, we'll typically give them a set of balloons. But we always make sure that something special happens on those special days.
We found that, these people a lot of times are alienated from family members. The holidays come along and there's nobody to stop by to visit, and it's depressing and sad, and they really, start to lose a little bit of control there.
We understand that it's difficult having strangers come into your house, basically invading your space. What we want people to understand is that we don't come in and take over. What we do is we come in and assess initially with a professional what your needs are, when you want us there, what you need us to do when we show up there, and we do this all in coordination with your doctor or whatever caregiver it is that you have.
As soon as we had Helping Hands come in and the first people that we met, everything was fine. I knew this was a good decision, and Mom was very comfortable. Mom's very comfortable with everybody that we've met. Helping Hands works totally with our schedule, whatever we need. If we need a little more, a little less, we need mornings, afternoon, whatever. They've been very, very flexible and very helpful. They arrange so many things without my having to continually make more and more phone calls. They offer so many services for us.